to Pathology Riddles. Today we will be learning about how a fibroid or a leiomyoma looks like under the microscope. So as you know, leiomyoma is a tumor of smooth muscles, and the most important feature is interlacing and intersecting muscle fibers. Now what do you mean by interlacing? Basically, if I can show you with my hands, interlacing is basically like this. This is called interlacing of muscle fibers. Different muscle fibers coming and joining together. Now intersecting. As you know, there are crossroads, intersections in a road. So intersections or intersecting means basically the muscle fibers are crossing each other. Basically they are going like this. Okay, so these are the two important features of your smooth muscle tumor, which is called leiomyoma or fibroid. So here you can see both interlacing and intersecting patterns. Above you can see two of the muscle fibers crossing each other. Below where the pointer is there, you can see the muscle fibers are coming together and becoming one. So that is all about leiomyoma. I hope you have understood the pathology. Please do comment below.